All right, let's dive right in. Today, we're talking about one of the most urgent medical emergencies on the planet, an ischemic stroke. We're going to break down what a brain attack really is, how you can spot one, and why this incredible high-stakes race against time kicks off the very second those first symptoms appear.
So, let me start by asking you a question that really frames this whole thing. What if your brain aged more than 3 years in just 1 hour? I know, it sounds impossible, right? But that is the terrifying rate of brain cell death that doctors are up against during a typical stroke. It's not just a medical problem, it's like time itself is accelerating against you. So, to really understand why it's so incredibly devastating, we first need to look at what's physically going on inside the brain when this sudden attack happens. At its core, an ischemic stroke is basically a plumbing problem, a really, really bad one. That word ischemic, it just means a lack of blood flow. So imagine the arteries in your brain are these super important highways. A stroke is what happens when one of them gets suddenly totally blocked by a clot. All traffic just stops, and a whole region of the brain is cut off from the blood it needs to survive. And the second that blockage happens, it kicks off this absolutely catastrophic domino effect. With no blood flow, there's no oxygen, no glucose. Now, brain cells are incredibly hungry for energy, and all of a sudden, they're starving. They can't work, toxic gunk starts building up, and the cells themselves start to swell up and, well, die. And this is what makes a stroke a whole different kind of medical emergency. It's not just a problem to be solved. It's a problem with a brutal, unforgiving deadline. It is a true race against the clock. You know, in the world of stroke care, there's a phrase you'll hear over and over again. It guides literally everything. Time is brain. Just those 3 words. They drive every single decision, from the moment someone calls 911 to the second they hit the emergency room, because every tick of the clock means more brain tissue is at risk of being lost for good. And if you really want to feel that urgency, just look at this number. During a typical stroke, the brain is losing an estimated 1.9 million neurons. That's not per hour. That is every single minute. And it's not just the cells. In that exact same minute, the brain loses about 12 kilometers, that's roughly 7.5 miles, of the vital nerve fibers that connect everything. We're talking about the actual wiring for your ability to speak, to move, to remember, just being erased. The speed and the scale of the destruction it's just staggering. So, if time is the enemy, then our single most powerful weapon is recognition. And luckily, there's a really simple acronym that can turn literally any one of us into a potential lifesaver. It's called FAST. It's a super simple check you can do. F is for face. Ask the person to give you a big smile. Does one side of their face droop down? A is for arms. Ask them to raise both of their arms. Does one arm start to drift downwards? S is for speech. Ask them to repeat a simple sentence back to you, like, the sky is blue. Is their speech all slurred or strange? And then there's the most important letter, T, for time. If you see even one of these signs, it is time to call for help immediately. Don't wait. Now, you might also hear people talk about B fast, which just adds a couple more signs. B is for a sudden loss of balance, and E is for sudden trouble with your eyesight, like blurry or double vision. The key word for all of these you'll notice is sudden. If any of this stuff happens out of the blue, that is a massive red flag. Okay, so you've recognized the signs, you've made the call. What happens next? Well, the race against time just shifts gears and continues right inside the emergency room. The very first thing that has to happen, once they make sure the patient is stable, of course, is a CT scan of the head. And this isn't just a routine scan. Hospital teams are drilled to get this done unbelievably fast. For a lot of teams, the goal is to have that scan done within just 20 minutes of the patient even arriving. So why is this one scan so critical? It's because it helps doctors answer the single most important question. Is the stroke caused by a blockage, which is ischemic, or is it caused by a bleed, which is hemorrhagic? See, on a CT scan, fresh blood from a bleed shows up as a bright white spot. But in early ischemic stroke, it often looks totally normal. And figuring that out is life or death. Because giving a clot-busting drug to someone who has a brain bleed, well, that would be absolutely catastrophic. So once that bleed has been ruled out and an ischemic stroke is confirmed, the medical team can finally go on the offensive. Let's look at the modern tools they have to fight back and restore that critical blood flow. There are basically 2 main lines of attack here. The first is a clot-busting drug. You'll often hear it called TPA. It's given through an IV, and it literally goes in and dissolves the clot. The catch? The time window is incredibly tight. It works best if it's given within about 3 to 4.5 hours. Then, for bigger clots, or if more time has passed, there's another amazing option, a mechanical thrombectomy. This thing is basically like a plumber's snake for your brain. A doctor actually threads a tiny catheter up through your arteries all the way to the clot and physically pulls it out. It's incredible, and it can sometimes be an option up to 24 hours after the stroke started.
So what's the goal with these treatments? Well, it's not to bring back the brain cells that have already died. That's called the ischemic core, and it's gone. The real goal is to save what's called the penumbra. Think of it as the area of brain tissue surrounding the dead core. It's at risk, it's failing, but it's still alive. It's salvageable if you can get that blood flow back quickly. That's the tissue they're fighting for.
And finally, after that immediate crisis is over, the whole focus shifts to prevention, to making sure this doesn't happen again. And that means long-term strategies, like daily aspirin to make your blood less sticky, special meds for heart conditions like AFib, statins to manage cholesterol, and of course, keeping a really close eye on blood pressure. And all of this brings us to a final, really important thought. Knowing the signs of a stroke doesn't just make you a little more informed. It actually makes you a potential first responder. For your friend, for a parent, for a total stranger. So the real question isn't just about what you learned here, it's whether you're prepared to act on it.